Hello friends, this is Sonu, and today we'll complete the rest of the discussion that we have to discuss about the Parkinson's disease. We already discussed the main, we can say main pharmacological drug that now it is a very popular use. That is the dopaminergic stimulator, means any drug that stimulates the dopamine and normalize the dopamine in the CNS. Today we'll discuss anticholinergic, that is the central anticholinergic. As I said that it's not we can say drug of the choice for the Parkinson's disease, but in somehow in some conditions this drug is helpful for the Parkinson's disease. So first of all, these are the drugs which belong to the anticholinergic drug. One thing I also want to say that anticholinergic, a lot of drug which belong to the anticholinergic drug, but this drug is especially for the Parkinson's disease because this drug is a good action in a central nervous system as well as peripheral nervous system as compared to other anticholinergic drug. For example, like atropine is a very popular drug of the anticholinergic. So as compared to atropine and other drug, this drug is the good for the Parkinson's disease. You can say this drug is a trihexyphenidyl, procyclidine, bipyridine, and benzotropine, promethazine, and orphanadrine. Actually, promethazine and orphanadrine, this drug is the H1 antihistamine. But in a CNS, in a central nervous system, it's a significantly work like a anticholinergic. That's why this drug also I include in the central anticholinergic. But basically, according to classification, this drug is belong to the H1 antihistamine. So let's discuss about this drug very briefly because this drug is not mostly good treatment for the Parkinson's disease. As I said that this drug is the only help 10 to 25% for the treatment of the Parkinson's disease. This drug little bit improve, or we can say whenever the dopaminergic agonist or those drug would increase the dopamine level in the body, in the CNS, those drug is a contraindication. For example, levodopa is a very popular drug. So maybe levodopa is a contraindication for the patient. On the time, this drug can be helpful, but not mostly good efficacy. This drug is very, we can say, very low efficacy and very not good for the treatment of the Parkinson's disease. But in somehow some conditions we can use this drug, or we can say this drug is the just we can say supportive role in the Parkinson's disease. So whenever patient has, for example, decrease the dopamine and increase the acetylcholine in a Parkinson's disease patient. So due to increasing the acetylcholine, the patients have a specific typical symptom, that is the rigidity and tremor. The two main symptoms are developed whenever increase the acetylcholine in the CNS. So on the time this drug is helpful. This drug can decrease or maintain the rigidity and as well tremor. The all drug which belong to the central anticholinergic drug. So that's why we can use this drug, but you have to remember that this drug is not for the well treatment, or we can say this drug is not for the daily use, like the levodopa the patient is used daily, like 4 to 5 times in a day. But this drug not like that. This drug just either in a contraindication or either in some other conditions, or either whenever rigidity or tremor is increased due to increase the acetylcholine, on the time you can use. But when you normalize the dopamine on the time, this symptom also disappear. So mostly whenever the levodopa is a contraindication and some other drug is contraindication, on the time you can use. Otherwise, normally this drug we are not using. Next, one thing also I have to say that none of these any drug which completely cure the Parkinson's disease. Just we can say that it's a symptomatic therapy. According to the symptom, this drug is stimulate the either dopamine neuron, either dopamine receptor, or just normalize the dopamine level in the CNS. Or we can say that it just normalize and maintain the dopamine. That's why patient will feel better. After maybe 5 to 6 years, it can be treatable by the drug or pharmacological drug. but the completely cure is not possible. So let's briefly discuss about the drug. As you know that from the physiology that in a CNS all neuron are cholinergic neuron. Most probably all neuron are cholinergic neuron. So this drug is also affect that neuron who is a cholinergic neuron because they bind and start the effect. That's why the side effect is a very we can say the very too much side effects like blood vision, then in a heart because it's an effect on a central nervous system as well as peripheral nervous system. So in a peripheral, let's start from the central nervous system. In blood vision, then impairment of memory, then cognitive dysfunction, forgetfulness, the same impaired memory. In a peripheral, it can be arrhythmia, mostly bradyarrhythmia because it's blocked the MP receptor, muscarinic because anticholinergic, anti-muscarinic. So M2 receptor are there in the heart, so can be bradyarrhythmia most probably, and in a GIT constipation due to blockage of the M3 receptor, constipation, urinary retention, urinary retention. Mostly patients suffering from benign prostate hyperplasia, BPH, on the time. So these are the main side effects, or we can say that whatever side effect of the anticholinergic, like atropine side effect, the same side effect can be seen in the central anticholinergic drug for the Parkinson's disease. The same side effect, almost the same. Even action also the same, but as compared to that drug, little bit good we can say good action in the central nervous system as well as peripheral nervous system. So this is the main side effect. And about the indication, mostly this drug is used for the anti-Parkinson's, but in like a for example the using atropine on whatever the indication of the atropine, on that indication also we can use this drug, but this drug is only for best drug for the anti-Parkinson's as anti-Parkinson's drug, not for the anti-muscarinic or anticholinergic. So I think this drug is not important for the anti-Parkinson's, but as I said, in some conditions we can use. About the H1 antihistamine, as I said that this drug is significantly act like anticholinergic, but due to H1 blocker, sometimes sedative action can be seen whenever you apply the orphanatine and promethazine due to the block the H1 receptor. So sedative effect in some time. Actually this drug promethazine thioacetate, this drug is only usually this is a drug of choice for the antiemetic, for the prevent the vomiting, but also this drug used for the some other indications in some conditions. Or one thing, any drug which inhibit or which blocking the dopamine receptor or dopamine neurotransmitter, those drug is just absolutely contraindication for the Parkinson's disease. Or any drug which, for example, antipsychotic drug. So in a psychotic patient are contraindication this drug like anti-Parkinson's drug, because in a psychotic patient the patient taking drug for the antipsychotic drug, this drug is the decreasing the dopamine, or on the time if you give the anti-Parkinson's drug and this drug is stimulating or enhancing the dopamine, so that's why the absolutely contraindication for each other. That is the you have to remember. Now we will discuss in urgent cases and emergency cases, what you will do? For example, as prolonged use, the levodopa is affect impairment of the fluctuation or on-off fluctuation of the motor function. So in urgent case, or we can say emergency cases, on the time, what you will use? One drug that is named apomorphine. Apomorphine, actually this drug is belong to the as a emetic drug whenever need to vomiting. For example, some person is take any poison or any other substance that need to vomit, that maybe by the vomit it can be go out, and maybe the person will not toxic too much. On the time this drug also used, but this drug is the potent dopamine stimulator, potent stimulating of the dopamine. So in freezing condition, or we can say akinesia means the person suddenly stop the movement, because in on-off fluctuation, whenever off fluctuation is there, the patient suddenly stop the movement. Even they can't raise the finger, they can't raise the hand. On the time, if you intramuscular, if you give the apomorphine, within 10 minutes it start the action, because it's a potent stimulator of the dopamine. But it's not regular use, or we can say just 24-hour. Whenever you apply this drug, after 10 minutes they start the action, or maybe 20-hour or 24-hour it will be action, then it's automatically disappear when drug action become go down. So this drug is only in urgent cases, like in akinesia conditions, or in we can say off fluctuations. On the time, apomorphine is a good drug for the movement or for the still instant relief. Yeah. And the apomorphine also, as I said, that it's a emetic drug. It's go and very potently stimulate the chemo trigger zone. It's a very potent stimulator of chemo trigger zone. That's why patients have severe nausea. Whenever you start the applying, after maybe 2 minutes or 3 minutes, they feel very nausea and sometimes very severe vomiting, because it's a potent stimulator of the CTJ, chemo trigger zone. That's why it's a drug also belong to the as a emetic drug. And some other treatment, like in some books or some authors said that surgery treatment, but it's not still successful, because in a surgery treatment, they thalamoectomy, or maybe stimulate the pars compacta in the substantia nigra, that by the stimulation the pars compacta it's release dopamine, because stimulate the neuron. But this method is still not successful. In some patients say that it's good for, but after 2 months they start the same problem. So this is still not successful. Still that these drugs are taking the patient who's suffering from Parkinson's disease. And one thing also, that some authors said that due to the oxidative metabolism of the dopamine, it releases free radical. And as we know that free radical is our human body, for human cell, it's a very toxic. So due to oxidative metabolism of the dopamine, it's release a free radical, and that free radical, it's increase the degeneration of the neuron. And in a Parkinson's disease patient, the suffering from this neuron is still progressive degeneration, and along with the dopamine metabolism, they also enhancing the degeneration, but still not proof at. But some authors said that like that will be the happen, and that's why after 5 to 6 years, the taking the levodopa, the patient condition become too worse, because the levodopa is increasing the side effects and decreasing the positive effect due to this reason. So I think this all the information about the Parkinson's disease that we already discussed, and I hope you will understand about the Parkinson's disease now. In the next pharmacological discussion, we will discuss opioid and non-opioid drug. So very soon we will try to discuss. I hope you will understand about the Parkinson's disease. Thank you so much.